everybody.
Oh, my goodness.
Great to be with such a distinguished group of people this evening. Everybody.
Oh, thank you.
Oh, my goodness.
Everybody. Great to be with such a distinguished group of people this evening. Great to be with such a distinguished group of people this evening. Oh my gosh, I keep on hearing myself over and over again.
Oh, my goodness.
Ron, your name says Renita.
Oh, you're right. Thank you for noticing that. Yes.
I said, funny, you don't look like Renita.
Oh my gosh, I keep on hearing myself over and over again.
Oh, my
I am
goodness.
hearing an echo of myself over and over again, though.
Ron, your name says Renita. There you go.
Ah, your name's right now. Okay.
Hi, Stephen.
Ah, hello, John. How are you?
Good. Nice to see you.
Nice to see you as well. It's been a long time.
Yeah. We both have much longer hair. It's practically 1974 in our house.
Yeah. I think mine was fuller and darker, but I don't know.
Mine's so long you can see the ponytail without me turning my head.
Oh my God.
So, Chair Davis,
I don't, yes.
I think we can begin. We're live.
Oh my God. Are we ready? Pardon me. Good evening, everyone. Welcome to the 20th Paul Starke Warrior Awards for the evening. That's what we're here to actually do. And let's see, and I should introduce the mayor, wherever she is on my screen. Lindsay Horvath, you are up.
Thank you, Chair
There
David.
you are. Probably not the best introduction you've ever had.
That's all right. It's the shortest and I love it. I want to thank you and the entire Human Services Commission, our Social Services Division, and everyone who's made tonight possible. Thank you for joining us for World AIDS Day in West Hollywood with the Paul Starke Warrior Awards. Typically, this event would be following a march and a procession down Santa Monica Boulevard, obviously due to COVID-19 health guidance from the public health department. We're not doing that this evening, but I did take the opportunity to walk the boulevard and see the name plaques with the beautiful flowers that were placed earlier today to remember everyone in our community and where the trees are planted. And if you haven't done that today, think about maybe doing it tomorrow, maybe to take a moment and hold memories dear in your heart, and to hold a memory for our community and what we have experienced as a city. Our annual recognition of World AIDS Day is a chance for us each to stop and take note of the extraordinary loss that our community has experienced during nearly 4 decades, as well as our remarkable resiliency in the face of that loss. And of course, today we're now facing yet another health crisis in the form of COVID-19. We know that our community has survived and thrived through such tragedy and loss, and the lessons that we've learned are important today as much as they've ever been. And in honor of the friends and neighbors and loved ones we've lost due to HIV and AIDS, we continue our fight to end transmission through education, access to medical care, and resources for all people. Tonight, we're going to recognize outstanding employees and volunteers of local agencies that offer HIV, AIDS, and/or substance abuse prevention care and services. These warriors we will recognize tonight are providing compassionate support services to community members living with HIV, many of whom are currently isolated and living in fear of COVID-19. The warriors continue to provide outstanding services to our most vulnerable community members during this extremely challenging and traumatic time. I want to congratulate all of the award recipients on behalf of all of my colleagues who are here tonight. And I know Councilmember Duran and Councilmember Mayor Pro Tem Heilman were not able to join us this evening, but with us tonight are Councilmember D'Amico and Councilmember Meister. And I know on behalf of all of our council, we want to thank you for your steadfast dedication to our community, to our shared vision of bringing an end to HIV and AIDS. It's been my honor this year to also join the Ending the HIV Epidemic Steering Committee for LA County to represent our city. And I thank our staff for the work that they're doing to have our city play a leadership role in that effort. Now I will turn it over to my colleagues to see if they would like to also share remarks first. I'll turn it over to Councilmember Meister.
Oh, well, I just want to congratulate all the honorees and just say that you're all outstanding. And we always look forward to tonight's awards, and World AIDS Day is a very somber and special time for all of us to reflect. And I'm sorry that we can't all be together. And I also want to thank David Reed for AIDS Watch, which he does every year, and it's just an amazing project that he's done for all of us to be able to see the names of the people that we've lost. Thank you, Mayor.
And Councilmember D'Amico.
Thank you, Mayor. I guess maybe it won't have the same, won't be the same experience, but I do think it's worth taking a moment and mentioning either the name of someone you know who died of AIDS, or someone who you didn't know who died of AIDS, but you might know their name, or just in fact think about how more than 30 million people across the globe have died during this pandemic. And in just the last year alone, more than 1 million people became HIV positive in places nowhere near here, the center of West Hollywood, but certainly nearby, because we know how complicated it is to live with HIV, no matter where in the earth you are. So I'll start with a name of someone who is dear to me, and perhaps we can just take 15 or 20 seconds to say names. And I'd like to mention Daryl Brantley.
Harold Bishop.
My partner, Jose Santos de Rodas.
Bob Braithwaite.
Stephen Pecoraro.
My dear friend Keith McDaniel.
Kevin, Garry, and Matt.
Moses and Scott.
Frank Santos.
Ray Lopez.
Thank you, Mayor.
Thank you. And since it is a time of social distancing, I'm glad that we're all here together. While we are keeping our distance to be safe, being together, especially in a moment like this, is so critically important. So thank you once again to everyone who's been able to join us. I see our colleague in the city of Los Angeles is here with us. Hello to our LA City Controller, Ron Galperin. I know he'll be introduced next, but welcome everyone, and thank you for joining us. Back to you, Mr. Chair.
And I'm going to pass it to my vice chair, Ms. Thomas.
Thank you, Chair Davis, Mayor Horvath. We'd also like to extend thanks to the entire West Hollywood City Council, Human Services Commission, and HIV substance abuse services providers all over. Next up, we're very pleased to have a video from Congressman Adam Schiff.
Hello, I'm Congressman Adam Schiff, and I am proud to represent California's 28th Congressional District. In honor of World AIDS Day, I want to take a moment to thank all of the 2020 warriors who do incredible work offering care and vital services in the fight against HIV/AIDS. The hard work that each of you do in giving of your time to this valiant effort, especially during a pandemic, is deeply appreciated by the entire community. In Congress, we've been working to pass legislation to directly deal with the HIV/AIDS epidemic. Last July, I introduced the PrEP Access and Coverage Act, which will expand access and insurance coverage of PrEP, the proven HIV prevention drug. Simply put, we have the medical resources to end the HIV epidemic, and we must ensure that every American, regardless of their income or identity, can access them. In the next Congress, I'll continue to push legislation that ends the HIV/AIDS epidemic once and for all. With your continued help, I'm confident we can reach that goal, and soon. Thank you again for your commitment to this fight, and congratulations on all of your hard work. Thank you.
Though he couldn't be with us this evening, we're just very honored to have that recorded word from Congressman Schiff. And next up, I am very pleased to introduce Los Angeles Controller Ron Galperin. Ron Galperin is the taxpayers' watchdog at City Hall, making sure public dollars are spent efficiently and effectively. He is also the elected paymaster, auditor, and chief accounting officer for the City of Los Angeles. Mr. Galperin oversees a team that conducts independent audits, manages city payroll and spending, prepares financial reports, pursues fraud and waste, and works to create a more transparent and accountable city for everyone. His reports are improving street maintenance, arts funding, management of special funds, emergency services, and many other city functions. Mr. Galperin, the floor is yours.
Wow, I had no idea I was going to be getting that kind of introduction. Good evening, everybody. It is great to be with you representing the West Hollywood suburb of Los Angeles. And I just wanted to thank everybody in the city of West Hollywood for all of your leadership over all of these many years and the example that you set. And when we look at progressive policies, when we look at policies that help those who are dealing with HIV and AIDS and our LGBTQ plus community, there is no place on earth that has exercised more leadership than the city of West Hollywood. And thank you so much to the mayor for your thoughtful and caring and effective and principled leadership, along with the council members that are here. I'm really honored to be with you. These are really challenging times, as we all very much know, with the COVID pandemic, and we've lost too many of our family members and our loved ones and our friends and our colleagues to COVID. And I'm very proud of the way that AIDS and LGBTQ plus health and advocacy organizations have stepped up with info and with resources and with assistance and so much more. And let's be frank, our community in many ways was on the front lines and still is on the front lines when it comes to COVID and when it comes to HIV and AIDS. We've been there, done that, as it were, and have experience in dealing with pandemics and with marshaling resources and with pioneering new treatments and with prevention and leveraging advances in HIV for COVID treatment and much more. I'm really so amazed by the work that's been done by the awardees and the honorees, these warriors and these heroes. And I want to just thank them so much for all they do and for everybody who's on this Zoom call. I can't wait until we can be together as one. And we, though, are here as one on this call, remembering so many people who came before us and also making sure that one day soon, once and for all, we can say that HIV and AIDS will have been completely in the rearview mirror, as with COVID-19. Thank you so very much, and great to be with you.
Now it passes back to me. I'm sorry, I was muted. Thank you very much, sir. It was very nice.
Thank you so much.
Yes. So moving right along, I'm now going to introduce Dr. Aaron Ceballos, excuse me. He is a National Science Foundation Fellow, a regular presenter at the American Public Health Institute Association National Conference, and widely cited author. And for the last 15 years, Aaron has been the managing partner at Maroon Society, a local behavioral research firm. He works with government agencies to improve public health, including how police respond to 911 calls of domestic violence, how mental health services are deployed, implementation of laws regulating youth access to tobacco, and most importantly, working closely with the city of West Hollywood on their critical response to treat and prevent HIV through the HIV Zero initiative. And I can't see the doctor, but
I'm here.
You're here. All right, you're on, sir. Thank you.
Thank you. Let's see here.
Great picture.
Okay, good evening, everyone. Always a pleasure to be here. What happens when a deadly virus spreads across the community? A virus that attacks the immune system, it targets the lungs, resulting in respiratory complications, leaving people to suffocate to death, often alone. Understandably, the world is gripped with fear. Who has it? How do we get it? If I get it, how long will I live? Communities then search for answers. Scientists rush for ways to test. Doctors scramble for treatment to save lives. And fear gives way to discrimination, and this generates stigma that grows stronger with each passing day as the death toll rises, while elected leaders remain silent. This was the reality of the early days of the HIV epidemic. And though it is very familiar to how the last 9 months of the COVID-19 pandemic has been, the major difference is leadership. And that COVID-19 is not primarily targeting and attacking gay men. It was the leadership of the West Hollywood community that said enough. You know, our community deserves better. We will not allow our friends, our family, and our lovers to die in vain, and we will not remain silent. And many of you on this Zoom meeting are the leaders that we are celebrating. You demanded medical advances, legal protections, and social programs to stomp out and eradicate stigma. And tonight I'd like to celebrate the leaders of the West Hollywood community that made these advances possible. Of course, this includes all the people who are on this call, as well as those that participated in the development of the HIV Zero initiative. This includes social services, providers, city administrators, commissioners, as well as city councilors, and many others who I'm sure participated but are not going to be named at this point. So in 2017, City Council created and passed the first HIV Zero initiative, an initiative of this sort in the county of Los Angeles. The county then followed suit several years later. And this initiative has 4 broad goals: to increase access to healthcare through health insurance, reduce new HIV infections, reduce HIV-related disparities, and reduce the transition from HIV to stage 3 or AIDS diagnoses. And so I'm going to talk about the progress that has been made toward these broad goals. So as we can see in this slide, the access to healthcare or health insurance has steadily gone up from 2014 through 2018, all the way to 87% for those that are the most likely to acquire HIV. We know when people have access to healthcare, they're more likely to be virally suppressed if they're living with HIV, and if they're not, they're more likely to have access to healthcare like PrEP, pre-exposure prophylaxis, that can allow them to avoid acquiring HIV if they are to be exposed. Here, the second goal, to reduce HIV diagnoses, we see that we have steadily made progress as a community to reduce the spread. When we initially developed the initiative back in 2017, our goal was to get under 60 new diagnoses per year. And as you can see, as of 2018, we are well below that figure with 27. The third goal includes linkage to care, viral suppression, and retention in care. And this first slide, as we can see, what's important to look at is, although it looks like we have held steady between 80 and 78 over the past 3 years, actually between 2016 and 2018, a number that's really important to look at is the denominator, or that 27 at the bottom. It's that's demonstrative of the progress that has been made. And linkage to care is a metric that looks at how quickly we're linking someone who has a new HIV diagnosis to medical care within 30 days. And so that this figure is actually very promising, that we're at 78. We've held the line from 2017 to 2018, and we would like to push that number higher. But the more important number is that we only have 27 new infections as of 2018, or diagnoses. The third goal, as I mentioned, has 3 different metrics that we look at. And again, for this particular metric, retention in care is measured by looking at how many doctor visits a person has annually, separated by at least 3 months. And although the figure here as well has kind of been stubborn and stayed at 51%, what's important to know is that when we look at those who are retained in care, we see the figures higher when we just look at one doctor visit. But clearly, if we're not having more than one visit, the number is going to be less. And that's really reflective here in viral suppression. So viral suppression, as many of you may know, has to do with the parts of HIV that are found in the blood at any given time. And right now, the percentage who have achieved viral suppression, while it looks like it goes from 65% to 62%, that's true, but that's of the total number of people living with HIV. When we just look at those who have tested, the number is closer to 93%. And so what this says is that we want to make sure that those, as in the previous slide, who are retained in care are going to see their physician more than once so that they can be counted toward this viral suppression figure. And we can see what the true viral suppression is. But overall, it's very positive. As I mentioned, when we look at those who are tested, the viral suppression number of those tested is 93%. So now this brings me to our survey on stigma. And before I get into this, reducing stigma has always been one of the major pillars of the HIV Zero initiative and goals. And this number of participants has been made possible by the support of one of the commissioners, Jimmy Palmieri, who sent this out to his vast network of people on social media. In years past, we always had our surveyors at Maroon Society conducting the majority of the surveys in person at Pride Day, and then at Sample Saturdays. in the fall. And as a result of COVID-19, that wasn't possible. And we would just really like to thank Commissioner Palmieri for stepping up and making it possible for us to achieve our goal with the survey on stigma. That being said, I'm going to talk about briefly some of the results, early results of the survey on stigma, and we're still receiving surveys, just as a side note. So as you can see, the majority of participants identifies cisgender male, about 69%, almost 70%, and about 27% as cis female, 2% as trans female, and 1% as non-binary. The majority of participants identify as either gay or bisexual, with straight representing just about a fifth, or 21% of the participants. 5.6% identify as lesbian, 3.4% sexually fluid, and 1.7% another sexual identity. And what we're really proud of is the fact that we overrepresent those who are living with HIV in our sample. In West Hollywood, about 13% of men are living with HIV, and in the total population. So we're almost tripling that, at least in terms of our representation in the survey, which is, critically important, since the survey is about stigma related to HIV and sexual identity. So almost a third are HIV positive. Another part of the survey that we're really happy with is the fact that we know that there are many long-term survivors, and our survey is reflective of that portion of the community. So about half of the participants are 55 years or older in our sample as well. And so when COVID-19 first showed its face, we wanted to be responsive to that with our survey. Even though we're tracking results year over year, we included some questions about COVID-19, and one of them was about fear. And we can see when we're looking at fear related to transmitting or acquiring HIV, it's around 12% and almost 16% respectively, whereas fear of getting COVID-19 is over 50%. So there's still a greater fear in COVID-19 than HIV in West Hollywood. HIV-related stigma is down, and we look at stigma related to how comfortable someone is disclosing their HIV status to new sex partners, their comfort asking new sex partners about their status, and then use of condoms with new sex partners, and concern about transmitting HIV. Oftentimes when we present, there's always a question about why the concern is so low among people living with HIV and transmitting HIV. And here are some of the responses. This is some of the answers that we've been responsive to. And so the reason people are not concerned about transmitting HIV is because that percentage is over 80% are virally suppressed. 43% of their partners are using PrEP. They're not sexually active. That's about 20%. They're in a monogamous relationship, or they're using condoms. And so this is really important to note that people are taking precautions, and there's a science-based justification for why people are confident in their sexual relationships. HIV-related fear is also down, and this is similar to the same questions, but among those who are negative, and that includes comfort disclosing their status to new partners, it's 96%, comfort asking, 70%. Use of condoms is down as 9%, and concern about acquiring HIV is also low. And the other side of that same coin, why are people not concerned about acquiring HIV? It's really driven by the advances in medicine. So biomedical advances are lowering the fears. And so that includes the use of PrEP, obviously not being sexually active. That's one reason people are not concerned. Being in a monogamous relationship, or having a partner that's virally suppressed, and then about 25% are using condoms. When we ask specifically about experiences of stigma, we see that still over a third of people living with HIV are experiencing some HIV-related stigma. 13% 30% report sexual identity-based stigma, and 13% specifically relate to some form of stigma from using PrEP. And then when we ask follow-up questions, well, what are the sources of these of the stigma? Basically, in what conditions or circumstances are you feeling stigmatized? The majority for HIV status relates to dating situations, similar with PrEP use. Sexual identity, on the other hand, is primarily related to family and employment settings. And those are the top line results of our presentation today. And if you have not participated in the survey or you know someone who would like to, please share the link. It's going to be live for the next few days. Thank you.
Thank you, Aaron. And to move, I'm going to provide a little information about the Paul Starke Warrior Awards, and Ms. Thomas will take it over. Commissioner, Vice Chair. Whoa, it's a lot.
Thank you so much. I also like to thank the doctor for that very thorough presentation. Before we present the awards, I'd like to give a little background to them. The Paul Andrew Starke Warrior Awards are given to employees or volunteers of local agencies who have done exemplary work in providing prevention, education, and/or direct HIV and AIDS services to West Hollywood community members. The awardees represent agencies that are funded by the City of West Hollywood and/or are part of the West Hollywood HIV and Substance Use Services Providers Consortium. Paul Starke was a former member of the consortium and an employee of Being Alive who died November 26, 2001. Paul worked in social services throughout his life, helping troubled youth, individuals with substance abuse problems, and people with HIV and AIDS. He was an important part of Being Alive as a member, president of the board of directors, and finally as a staff member of the West Hollywood Coordinator and Prevention that's in there twice. Paul was also very involved in the medical updates sponsored by Being Alive, AIDS Project Los Angeles, and the Positive Images Consortium.
Excellent.
Back over to you, Chair Davis.
Thank you. This is good. And now it is my pleasure to introduce Council, well, actually Mayor Horvath and Commissioner Meltzer to present the first award to Lisa Marie Ceballos. Oh my God. I apologize for chopping up your word, my other people's names. But if you guys would take it over, I could get out of this.
Thank you, Mr. Chair. Happy to do
Thank
so.
you.
And before we make this presentation, I also want to, I was informed that our council members elect John Erickson and Seppi Shine are also joining us this evening. So I want to extend wishes on their behalf as well. Lisa Maria Ceballos is a trans woman who was born in the United States and received her education at a private school in Mexico. Lisa currently works as a case manager at the TransLatin Coalition, woo woo, and provides outreach and support services to transgender and non-binary community members in West Hollywood. She is a dedicated community advocate and volunteers at Very Human and Food on Foot, where she helps people experiencing homelessness get a second chance through employment opportunities. She's being recognized for her hard work and dedication to the community.
Excellent.
And if you haven't visited TransLatin Coalition, when it is appropriate under our public health orders, please do so. It is an absolutely fabulous organization, and Lisa's work there is absolutely transformational. And I'll now turn it over to Commissioner Meltzer.
The TransLatin, thank you, Mayor Horvath. The TransLatin Coalition was founded in 2009 by transgender, gender nonconforming, and intersex immigrant women in Los Angeles to address the specific needs of the community. Since then, the agency has become a nationally recognized organization providing comprehensive resources and services that improve the quality of life of TGI people. We thank Lisa and the TransLatin Coalition for their commitment to the health and well-being of our community members. Accepting the 2020 Warrior Award is Liza Ceballos. Congratulations, Lisa. Thank you for all of the wonderful work that you do.
Thank you so much. Good afternoon to everybody. It's a really honor and humbleness to be able to receive this award. You know, I also want to recognize all the other members that make part of working with the city of West Hollywood, which is, I don't mention other names, I totally apologize. JC from Ascensia, Nicole from Tristana, Luna from the LGBT, Sara from Step Up, Darren from APLA, and Nancy from Ascensia. You know, I think I feel that the job that I do at the TransLatin Coalition through the TRUE program that is funded through the city of West Hollywood is so much important for the trans and non-binary individuals that reside on Hollywood. I feel privileged that I have a job, something that not a lot of the trans and non-binary individuals that are experiencing homelessness or doing sex work in the city of West Hollywood, but many other places, you know, don't have that privilege. And to me, it gets me really emotional to be able to get back to my community and make a difference in their life, especially in this hard times that COVID's been affecting us. You know, I will invite everybody to be intentional and to like keep supporting and investing in trans lives, so more services like this can not only be offered in the city of West Hollywood, but nationally, you know, like, and to like make a difference and give us the opportunity to exceed in life and be able to like have a place to sleep and have our basic needs. You know, I'm so honored and privileged to work for an amazing organization that makes and changes the lives of so many individuals that walk through that door, you know, and put a smile on them, and it's able to like give them the basic resources that they need. So thank you so much for this recognition, and I really appreciate it, and you guys have a wonderful afternoon.
Thank you.
Congratulations, Lisa Maria. Next up, I'd like to bring back Horvath and Commissioner Meltzer to present the next award.
Right, very good. Next, we would like to present a Warrior Award to Emmanuel Sanchez-Ramos. Emmanuel is a program coordinator for HIV Elders Program at APLA Health, and before that, he was the nutrition coordinator for Necessities of Life program. Emmanuel is a gentle leader who is empathetic and accessible, and he has earned the trust and respect of the community. He helped to make the Third Thursday HIV Elders Program a popular and welcoming space for older adults living with HIV. At 29, I'm gonna say that again, 29, Emmanuel has maturity and wisdom beyond his years. And he is an advocate for LGBTQ+ rights and the needs and concerns of all people living with HIV. His strong work ethic and dedication to serving the West Hollywood community make him worthy of the 2020 Warrior Award. We love your next gen leadership. Turning it over to Commissioner Meltzer.
APLA Health's mission is to achieve healthcare equity and promote well-being for the LGBT and other underserved communities and people living with and affected by HIV. APLA Health offers a wide array of services for the community, such as medical, dental, and mental health care, and programs for people living with HIV, such as case management, nutrition, benefits advocacy, and in-home healthcare. The HIV Elders Program is a monthly program held via Zoom that provides education and support services for older adults living with HIV in West Hollywood. We thank Emmanuel and APLA Health for their commitment to the health and well-being of our community members. Accepting the 2020 Warrior Award is Emmanuel Sanchez-Ramos. Congratulations, Emmanuel. Thank you for your ongoing dedication.
Oh, thank you so much. I just first want to thank the City of West Hollywood and its Human Services Commission for the recognition. I am deeply humbled for this award. I want to thank my APLA Health family just for welcoming me with open arms when I was starting my journey, especially to those who have shaped and guided me and supported me, like Brian Reesley and Jeff Bailey, who were there to provide the tools to just keep growing, not only as a person, but as a professional in the field of HIV and AIDS, because this is something deep to my heart. I'm very honored and grateful to receive this award and to be part of the community that showed me the true meaning of being resilient. You are all an inspiration, every single one of you. I'm thankful for the unconditional support of my padres, los quiero mucho, mis papás y mis hermanos, and my friends and my partner Miguel, who have been there from the very beginning. Finally, I just want to dedicate this to every client and person who I have come in touch with, and I've had the pleasure of meeting. Every single one of them has touched my heart. Clients have provided me with the tools and pushed me to think outside the box and to provide for them an opportunity and a voice to be heard. But in reality, they are the true heroes of everything. They are the ones that push me to be harder and work harder every day. And although there are some that are no longer with us, today and every day should be a day to remember them, because that's why we do the work we do. And although we are living through very turbulent times, one thing I have learned over the years is that the work that we all do doesn't stop. We continue every day, and there is still a need for awareness. There's still a need to fight prejudice. There is still a need to eliminate stigma and to improve education. I believe that united, we can continue the fight against HIV and AIDS, but together, working as one. So thank you so much, and thank you to APLA for giving me the opportunity to just be part of their teams. Thank you.
Very nice. Thank you very much. Am I on? Yes. Cool. It's now my pleasure to introduce Councilman Duran, who I know is not there. Is someone stepping in for Councilman Duran, or is Jimmy all by himself?
I'm stepping up.
You are stepping in. Okay, stepping in, stepping up is Ms. Meister, Councilman Meister, and Jimmy Palmieri.
Thank you very much, Stephen. It's my pleasure to present the next award to Christopher Aguilar. Christopher is a peer navigator at the Los Angeles LGBT Center and goes above and beyond the call of duty. He runs a fantastic harm reduction group and conducts the anger management portion of the center's intensive outpatient program. Chris is very knowledgeable about the program, and he's always providing ideas for new opportunities and growth. His boss says that it only takes a very short time of working with Chris that you quickly realize that this is not just a job for him, but something he is passionate about and truly cares for. You will never hear him say, "I can't," and he always finds a way to make it work. The center consistently receives feedback about how Chris has made such a positive impact on clients' lives. We are truly lucky to have such a passionate, dedicated person providing services to the West Hollywood community. Over to you, Jimmy.
Thank you, Councilmember Meister. The Los Angeles LGBT Center provides an array of substance abuse treatment services and provides a lifeline to community members struggling with addiction. The center provides one-on-one substance abuse counseling services and confidential support groups. The Methology Group helps clients develop strategies and goals to reduce or stop the use of crystal meth. Participants meet in a safe, non-judgmental space, and intensive outpatient program is designed to help clients with mental health challenges and any substance abuse problems, including alcohol, cannabis, crystal meth, crack, etc. We'd like to thank Chris and the LGBT Center for their commitment to health and well-being of our community members. Accepting the 2020 Warrior Award is Chris Aguilar, and congratulations, sir.
Hi, thank you, everybody. I think the name that sticks out the most to me or excuse me, to me would be my my former manager, Mike Rizzo. He really gave me a shot as somebody who was like less than a year into working in treatment. And that opportunity has really kind of given me a chance to see all the different areas to be of service. And I'm really just glad for that opportunity. And thankful to the center for allowing me to, thank you for letting me be of service, really. I mean, that's really the only thing that kind of comes to my mind. Yeah, that's just about it. Short and simple. Thanks for letting me be here. Thank you for recognizing the work that I do. And yeah, I'm glad I helped somebody. That's about it.
Congratulations, Chris.
Congratulations.
Once again, we'll hear from Councilmember Meister as well as Commissioner Shandrick, who will present an award to Garry Bowie.
Thank you very much, Marquita. We would like to now honor a very special person, Garry George Bowie, former executive director of Being Alive, who passed away due to complications from COVID-19 on April 7th, 2020. Garry had been an HIV activist since he was diagnosed in 1983 at the age of 22. Prior to Being Alive, he was the executive director of the Long Beach AIDS Foundation and responsible for raising and distributing millions of dollars to HIV organizations. During his tenure at Being Alive, Garry restructured the organization and increased client service deliveries by 180%. His visionary leadership was the catalyst for growing the mental health program and more recently by establishing the syringe exchange program. Garry's favorite thing was talking to clients and listening to their inspirational stories. He believed that our stories are our power. Garry's reach spread far beyond what has been mentioned. He was an active member and president of the Satyrs Motorcycle Club, the oldest gay motorcycle club in the world, where he passionately researched and archived the club's history. He had a keen interest in film and filmmaking, along with an eye for design with print materials. Over to you, Patrick.
Thanks, Lauren. There is no way to summarize the impact Garry had on the HIV positive community, the LGBTQ+ community, and the people that know and love him. I think tonight's call with these amazing honorees amongst him and our leaders and our warriors is a testament to the work he's done and to the people he has touched. His dedication, tenacity, and passion to serve others and to educate and inspire young leaders will live on for generations to come. To say he is greatly missed is a terrible understatement. His impact will continue to ripple far beyond his aspirations, and Garry's legacy is the very model of this Paul Andrew Starke Warrior Award. We thank Garry for his steadfast service to West Hollywood, and he will be dearly missed. So I want to hand it over to his husband, Jeff Wacha, to accept the 2020 Warrior Award. Thanks, Jeff.
Thanks. It's Waka. Don't feel bad. Everybody does it. It looks that way. Good evening. I'm honored to accept a Paul Andrew Starke Warrior Award on behalf of Garry Bowie, my husband. For those of you who did not get the opportunity to meet Garry, that's him looking over my shoulder. We lost Garry to COVID on April 7th. It's been a tremendous loss for me and for our families. His mischievous grin and sparkle that was always present in his eyes is something we continue to sorely miss. More importantly, the community has suffered a significant loss by no longer having access to the advocacy, mentorship, advice, counsel, and the genuine love he had for the community he served. Garry gave more to the community than anyone I know. There was an inner passion that burned within him that guided him in helping anyone in need. Garry was pretty much in a state of above and beyond at all times. His care and concern for those that were fortunate enough to cross Garry's path were endless. I've been asked by several people what drove Garry, why he did the things he did. And the only answer I could ever come up with is that was just Garry's nature. He didn't do things seeking alkaloids or awards. Everything he did was just to help others. He believed that no one should be left to go it alone or to go without. Even while Garry was fighting COVID, he was texting staff on a daily basis, doing check-ins, and he spent an enormous amount of time on the internet researching the latest information on the virus and then sharing that through social media. Someone once said of Garry that he taught the community how to take care of themselves. Sorry.
It's okay.
Even when he was incredibly sick, Garry's first thought was to help others. One of the many reasons Garry loved being alive was that it was a platform to help those living with HIV, teaching self-care, providing mental health services, case management, I'm so sorry, and a resource for those in need. During Garry's time at Being Alive, he and his staff doubled the number of client service deliveries from the first day he walked in until today. It was one of the accomplishments that Garry was most proud of. Garry hoped to see new HIV infections eradicated in his lifetime, and he worked tirelessly towards that goal. The board of Being Alive allowed Garry to dream and put those dreams into action for Being Alive's clients. He was incredibly proud of Jamie, Becky, and Sylvia, the staff at Being Alive, and their part in the agency's success. He truly loved the agency and the people he worked with every day. I'd like to thank the City of West Hollywood for bestowing this honor upon Garry. If he were here today, his acceptance speech would be about the great things that the agency is doing. He wouldn't talk about himself. It's just not what he did. It wasn't in his nature. And he's probably blushing right now because of all I've done. All I've done is talk about him. Thank you very much. I appreciate it.
Thank you. Thank you. I don't, these awards are very hard for me to go through in the first place. And I just, I'm sorry. I would like to now introduce Councilman D'Amico and Commissioner Reback to present an award to Spencer Shelton. And if I could pass it over to John.
Thank you, Chair.
I can't see you. There you are. Thank you.
Thank you very much. I have the pleasure of talking about Spencer Shelton. And when thinking about Paul Andrew Starke Warrior Award and hearing Liza and Emmanuel and Chris and Garry, we know that Spencer is, there isn't anyone more deserving and equally deserving and appropriate as Spencer Shelton. Spencer has been a long-serving volunteer for AIDS Healthcare Foundation. Spencer also finds the time to volunteer for several other organizations within the greater Los Angeles area, including Friends Research Institute, APLA Health, LACADA, Black AIDS Institute, and the LA LGBT Center, and Project Engage. Spencer was formerly homeless and had a drug problem, but now he's a role model for underserved youth, many of whom are going through the same issues he overcame. Whether it's walking a young person in to get an HIV test or taking another to get their identification or other services, Spencer will go out of his way to help someone in need. It's so extraordinary, the volunteering that he does. The many lives that Spencer has touched are countless. Spencer's selflessness and dedication to serving the community is truly inspiring and deserving of the Paul Andrew Starke Award. And now, Commissioner Andrew Reback will continue speaking about Spencer.
Where is he?
Andrew, you're still on mute.
Thank you, Councilmember D'Amico. The Los Angeles-based AIDS Healthcare Foundation is a global nonprofit organization providing cutting-edge medicine and advocacy to over 1 million people in 45 countries. AHF provides free walk-in HIV testing at their out-of-the-closet thrift store and mobile HIV testing van, conducting over 10,000 HIV tests in West Hollywood every year that we are really grateful for. Tests are performed by certified testing counselors using the most advanced testing technology, and test results are ready in 20 minutes or less. We thank Spencer and AIDS Healthcare Foundation for their commitment to the health and well-being for our community members And accepting the 2020 Warrior Award is Spencer Shelton. Thank you so much.
Hello, everybody. Thank you for this award. I'm about to cry, but I like to help everybody, no matter what color or race, to just get tested. That's just me. I have kids on the street that are dealing with HIV, and I had like friends that died of it. This disease is very powerful. I thank HF and West Hollywood to let me do the work I do. Thank you.
Thank you.
Thank you, Spencer, and congratulations.
Thank you.
Tonight, unfortunately, we do not have Mayor Pro Tem Don Heilman, so we will have Councilmember D'Amico present in his stead, and we will also have him joined with Commissioner Reback, who will present our final award of the evening, and that will be presented to Cheryl Hoffman.
Cheryl Hoffman has been working as a health educator and advocate for the trans community for over 20 years. Over the years, Cheryl has worked in many roles as a case manager and health educator. Cheryl's personal experiences have shaped who she is and have made her the dedicated community outreach worker that she is today. She has worked to connect trans women to a myriad of services such as medically monitored hormone replacement therapy, HIV care, mental health services, and housing. Through outreach, skills building workshops, transitional life skills, and support groups, she carries the message about HIV prevention and care. Andrew?
Thank you again, Councilmember D'Amico. Friends Community Center is the Los Angeles community site for Friends Research Institute. Friends Community Center, which is directed by Dr. Kathy Reback, provides services for and conducts research with substance-using gay and bisexual men, other men who have sex with men, and high-risk transgender women. The site is located on the border of Hollywood and West Hollywood with easy access to public transportation. The overall objective of the prevention program is to reduce the risk that can result from drug use by preventing HIV infection and managing the physical, psychological, and psychosocial manifestations of drug use without the requirement of absolute abstinence or recovery. The prevention programs are designed to increase social support and teach survival skills while participants gradually change their behaviors. We thank Cheryl and Friends Research Institute for their commitment to the health and well-being for our community members, and I am especially proud of their work. Accepting the 2020 Warrior Awards is Cheryl Hoffman. Thank you so much.
Hi, thank you all so much. I was encouraged to share a little bit about myself, so I have a little bit of a introduction about myself, if you can bear with me.
Take your time. We want to hear it all, Cheryl.
Thank you. That puts me at ease a little bit. Thank you so much. I was born in a small town in central Kansas, the child of an Air Force captain and his wife. As my father was promoted, he was stationed in Omaha, Nebraska, Hawaii, and Northern Virginia. In 1968, he was sent to Vietnam, and we moved back to Kansas to be closer to relatives. It was that year that I began to have difficulties in school. As I was assigned male at birth, but felt female, and I acted as such, this brought about much teasing and bullying in the classroom. I was misunderstood and misdiagnosed with a mental illness, which resulted in my being institutionalized from ages 12 to 16.
Wow.
Yeah. Upon leaving the Mental Health Institute, I drifted for 3 years, not really understanding my authentic identity until I was 19. And that's when I learned the term transgender. And I realized that that was my identity. I immediately began my gender transition and gender confirmation surgery. I had that at age 22, which was quite an unusual feat 41 years ago. After many years of turmoil during my youth, adolescence, and young adult years, it was a true relief to finally be comfortable in my skin. I entered the workforce in cosmetic retail sales in a department store setting and found my niche. As I am people-oriented and love makeup and fragrances, selling cosmetics was a perfect fit. After some years in the field, I went on to work in a brokerage firm, then into banking. In 1998, at age 41, I found myself in a Los Angeles day spa working there, but I had no health benefits. I was getting my hormone replacement medication from the BART clinic in Hollywood when I learned of a community-based organization that was looking for a peer advocate for community outreach specific to trans women. I interviewed and was hired. I was able to reach out to other trans women and give them the promise of a better life by my example. I learned the field of HIV prevention and provided information about HIV education and medically monitored hormone replacement therapy. I worked in the field of HIV at a couple of different agencies. Having gained additional experience as a case manager, I began working at Friends Community Center in 2016, which then culminated in a position as a case manager there for both trans and MSM populations. I'm still at Friends Community Center, where I work as a health educator with trans women and MSM in an HIV risk reduction setting. Through outreach, skills building workshops, transitional life skills, and support groups, I carry the message about HIV prevention and care. I have now worked in the field of HIV prevention and care for 20 years, and I can truly say it's been a rewarding 20 years and has provided me with personal and professional growth and gratification. I'd like to just say thank you to Mayor Horvath, Congressman Schiff, Ron Galperin, and the West Hollywood City Council. I'd like to thank also Dr. Kathy Reback, who's Executive Director at Friends Community Center, for nominating me for this prestigious award. I'd like also to mention my many coworkers with whom I do this very gratifying work in the field of HIV prevention and care. It's been a most rewarding experience for me. I'm very pleased and humbled to be among the other recipients for this great award, the Paul Andrew Starke Warrior Award. Thanks again.
Thank you. Very nice.
Thank you.
Thank you. I would like to kind of wrap up since we're at the end of this. And first off, I would like to thank all the awardees. Your stories all were very touching. It's very hard for me not to get through one of these without crying a bit. And in person, I have had difficulties. I've tried to figure out how to do it without crying. And I finally just given up and just go ahead and cry. What the heck? You know, I would like to thank all the providers and also the council. Thank you, Mayor Horvath and Ms. Meister and Mr. D'Amico. And I can't see, but I know Seppi and Mr. Erickson are somewhere in the room. So congratulations is in order and welcome. Thank you to all my fellow commissioners who do nothing but make us look good and make me very proud, all of you. It's a pleasure to do what I'm doing, actually. I'd like to thank Aaron. I'm not going to try to do his last name again. And I would like to thank the staff, especially I would like to thank Jenny for getting all this to work in the first place. I know she was a little on the nervous side, and I'm impressed. It worked fine. There weren't any glitches. All the glitches that she came up with didn't happen. So I want to thank everyone who helped her and her especially. So, and with that, I think we can call it an evening unless there's any reason not to. Hearing none, I would like to say thank you to all. Good night.
Night,
everyone. Congratulations.
Well, stay safe.
Yes, stay well,
Thank you
stay
again.
safe.
Wear your mask.
So much. Thank you.
Good night, everyone.
Never forget the mask.
Never.
Thank you.
Good night, everyone.